It's time we talk about what the press is not telling you that you need to know in order to deal rationally with this situation with the outbreak spreading around the world. We've been following it very closely since it first broke and had people in bubble suits and quarantines that haven't happened in 1,000 years. That's when we started following it because we noticed people in higher places, as in governments and things like that, were absolutely freaking out. And they didn't freak out over anything else except for Ebola. So, as it was spreading and they're acting like it was Ebola, we're like, oh, we're going to watch this a little closer than normal. This doesn't appear to be a hoax. And it's not a hoax. However, the media and the Center for Disease Control and the rest are not giving you the information that you need. They're giving you numbers that are creating panics and scares. This is the ever so famous coronavirus COVID-19 map created by Johns Hopkins University that is updated regularly. Not constantly, but regularly. You can see the world total here, total deaths of the planet. Now, let me rephrase that. It says total confirmed. 118,099 people have been tested and come back positive. That is not the number of people on planet Earth that have it. That is the number of people that have taken the test and the test has come back positive. So what you're not seeing here, because they can't show you that, is the actual number of people that get it but have cases so mild, or the system is so overflowing with the panicked people that they don't even get the test. And that is a very large number we can expect. But because we can't put a measurement to the word expect, it stays that one in concrete. Fine, nothing wrong with that. But you as an intelligent person need to be aware this is the group of people that have been tested and confirmed positive. It is not the actual amount of people that have had the condition. This is the total number of deaths. This number is legit. Total number recovered. This number is not legit. This is only reflected off of this number of total number confirmed. So, this number needs to be much, much, much larger, therefore making the total recovered number much, much larger, which therefore in percentages makes the total deaths number so much smaller. In America, 3 weeks ago, we hadn't done any testing, and we were at 35. Currently, we're at 808, which has got to make, what's his name? Eminem very happy. I'm pretty sure that was his big deal was 808. Here is the current map of America. Last night, this website altered the way that they record the red dots. Prior to last night, there was a dot for every city. And with having a dot for every city in the United States where it had it, this looked like a teenager's face galore. Now what they've done is they've altered it to simply the states. California has 140 active, 144 confirmed. Not actual patients, just the ones that were confirmed. So you can see they've limited the dots so that you're not looking at that poor teenager's face with the spots everywhere. So, these are the numbers we've been using, knowing these are wrong, but we can't put an actual number there, so this is actually good science that they're doing that. However, there should be an asterisk there to tell you the truth, which is this is only the number of people that have been tested and confirmed. When you're like, well, isn't that what total confirmed means? Yes, but not everybody who comes to this website is going to realize that. Just like they altered the website a few weeks ago that went from, it used to have confirmed and recovered. You had to figure out how many were active. Well, they added active because they realized some people just don't like to do math. Okay, that's fair. But it's also just as equally fair that this number should reflect the same idea. Showing, hey guys, this isn't the real number. This is just the ones that have taken the test and confirmed. The actual number is much, much higher, which is keeping this number lower because The number of people that aren't counted on this one are the people that are not being reflected on total recovered. So, once again, I'll repeat this and then we're going to move on. The total confirmed is actually much larger. The actual number of people who have had the condition is much larger, therefore meaning the number of people who have recovered is much larger. So, this is what they're showing you. What they're not showing you is the inflated number here, or the additional information that you should personally be inflating it, therefore inflating this. So they're not showing you that. The other thing that's missing from all of the press coverage is in the reporting of this condition. It is talk about black or white. They're telling you these are the number of people that have it. Nowhere in the reporting that I have seen does it show the level of severity of these 808 people. If you think all 808 of these people are going to drop dead, then you're not paying attention to this number. No. As we stated earlier, the number of people that have it is already inflated with this. But even these that are being tested, they have different levels of severity, and no one is reporting that, thus creating the hysteria. Take a look at this fellow. Coronavirus patient recovering in quarantine facility says he had a high fever, spike, and a lingering dry cough. This is what he reported. I had a precondition called, pardon if I get this pronunciation wrong, Guillain-Barré syndrome, and I think that's why they put me in the biocontainment, to make sure that I was stable and that the virus did not go into my lungs and chest, which seems to be the killer in this, he said, adding, this overwhelming majority of people who contact the novel coronavirus are ending up with fairly mild cases, just like I am. We continue with his report of the man who actually has it. Other than the spike in fever that I had, a lingering cough, I was fine, he continued. It was not like a regular cold, so there was no sore throat, no stuffy nose, no sneezing, no body aches with a high temperature, and other than that dry cough, I'd have been fine after about 10 hours, and my fever broke. So, as we've been told over and over and over, this condition strikes people that are 50 and above. This fellow, who celebrated his birthday in the hospital, was 66 and turned 67. So he's older, and he had a pre-existing condition. The two criteria that are being repeated over and over and over, thank goodness, that very few people are paying heed to. Goldman added that he is now feeling great, and that he wasn't contagious, and that if he wasn't contagious, which he still is, he would have been back at work. Passengers and crew aboard the Diamond Princess were subjected to a 14-day quarantine while docked in Yokohama, a port city near Tokyo. When we sat down to take off, I dozed off, and it was in the middle of the night. And then I woke up 2 hours later with a really heavy fever. It was over 103, he continued. So, he got it. He got a really high fever. He was knocked down. And then what did he say? How many hours later? I believe he said 10 hours later I was back to work. However, you can review the video to make sure just as easily. Let's go to the next part. What states have declared coronavirus emergencies? Or to put another way, what states are creating a panic because their leaders are grossly overreacting to a condition that belongs with 50 and up and pre-existing conditions? If you are under 50 and you get coronavirus, you might have a cough, you might have a sneeze, you might have none of that. You will have a high fever, apparently. But then, you're going to be fine, so says these numbers over here. The odds of you getting hurt in a car accident are through the roof higher if you're under 50 in relationship to getting the corona condition. At least 14 states across the U.S. have declared a state of emergency or public health emergency as cases of coronavirus continue to climb, of more than 600 cases. Yeah, we're at 800 now, confirmed. U.S. and at least 26 deaths. It's as of March 9th. Well, it's March 10th, and now it's 28. And most of them, let's go look just to confirm so we're not blabbing out of our body parts, are 23 deaths in Washington. That's the old folks' home. Meeting the criteria of elderly and meeting the other criteria of pre-existing conditions. So it's taking exactly who it said. If you are in those two categories, you have great reason to be concerned. If you are not in those two categories, what are you freaking out about? Put the toilet paper down, sir. Step away from the cash register. You're going to be fine. These are the states that have declared emergency. California, blue state. Florida, red state. Hawaii, blue state. Illinois, blue state. Indiana, red state. Kentucky, red state. Maryland, blue state. New Jersey, blue state. New York, blue state. North Carolina, not sure on that one. Ohio, definitely purple. That state can't make up its mind. Oregon, blue state. Utah, used to be a red state, but holy moly, did they go out for Bernie Sanders. There are a lot of socialists in Utah, it turns out. Washington, blue state. So the blue states and a couple of red states are really jumping on the panic bandwagon, scaring all of their constituents. Instead of saying, if you're under 50, what are you fussing over? You're going to be fine. Keep grandma and grandpa in the back room locked up until this is over, should you desire. Make sure that they're taken good care of, and you get your little booty to work. You're going to be fine. So says these numbers, but they're not trumpeting it. No, they're trumpeting fear, and they're not telling you that if you do get it, and guess what, under 50s, you are going to get it. You really are, but you're going to be fine quite quickly. Oh, but you're still contagious. But it doesn't matter unless you're over 50. Then you have a concern. Santa Clara, California bans all large gatherings in response to coronavirus. If there's more than 1,000 people, tisk, 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 just like France, you can't do it. As if you're at 900 people and the virus is going to go, oh man, there's only 900, I can't spread. Oh, well, I guess I'll just go home then and wait until a party happens that has over 1,000. Who makes up these rules? Scaremongers. That's who makes up these rules. Coronavirus containment zone in New York County shut down for 2 weeks to undergo cleaning. You really think that's going to work? So you really think that closing down a town for 2 weeks, and it's not really closing because it says in the article that the stores are still open. And oh, does he have the most ridiculous comment at the end. Let's see. These cases are not representing a random sample, Cuomo said, and while giving an updated case count, these are not satisfactory accounts of the spread or the growth of the disease. It is a selective sampling. We are primarily testing people who are associated with people who test positive, right? But he talks about how he's not going to close the town, he's just going to close down the businesses. New Rochelle, at this point, probably the largest cluster in the U.S. of these cases, he said, while announcing 10 new cases in the area brings total to 108. It's a significant issue for us. Is it? What's the ages of the people being affected? What's the status? What's the condition that you are not telling us? How are they feeling? Because we know from this map here that they're highlighting that we keep going back to, same map. Let's see if this one updates on the site. Because some of them do. It's really kind of cool. Oh, and they changed the names of the countries this morning on here. Instead of saying Iran, now it says Iran Islamic Republic of. Instead of saying Korea, it says Republic of Korea. So, wow, politically correct map now. But what I'm trying to get through to you over and over here, and please tell this to everyone you know that you care about, they're not reporting the severity. They're only reporting the black and white numbers, not the fact that you might get a fever and then you're fine the next day. If you have a pre-existing condition, get your booty to the doctor. If you're over 50, get your booty to the doctor should you feel the need. Even though technically there's no cure, they're just going to treat the symptoms. What else? Dr. Drew Pinsky is on, well, I got to admit, I'm on his side on this. Dr. Drew Pinsky, coronavirus panic must stop. Okay? In order to stop, you have got to quit declaring emergencies and freaking everybody out. When you have a death rate that is lower than car accidents in your state every single day, the total number of corona people that have died in the entire country is lower than the death rate of the car crashes in your state on a daily basis, or a weekly basis, or a monthly basis, you need to back off, because we're not going to shut down all the freeways because people have died. We do require people to have a driver's license. We should require people to know if you're over 50 and you have a pre-existing condition, you're in trouble. Everybody else, get your license and get out there and get to work. So Pinsky's saying that the press needs to be held accountable for hurting people. Hurting people? Yeah, there was a bunch of people in some country that died from drinking moonshine. Died from drinking moonshine in order to try and prevent the corona. Okay, that didn't work, and now they're dead. Good luck. Dr. Mark Siegel, who keeps being shown on all the other videos, and ironically on the story that's about him, they don't show that picture. Dr. Mark Siegel, closing schools, canceling events without immediate coronavirus threats just spreads fear. And considering we know this condition does not affect children other than a slight cold, maybe flu, for the tiniest amounts of people, and all children get better, and all young people get better, that's what the numbers show. Closing schools is for the paranoid grown-ups who are probably have 8 million rolls of toilet paper in their house now. They need to report the level of severity of the cases and the ages. This is ridiculous what's going on. It's good to, if you're in that group, you need to be concerned. And let's talk about that group. As we've alluded to them before on our other videos, Pelosi rejects calls to shut her Capitol. We are the captains of the ship. Now you want to talk about a group that should really be scared. It ain't the general public. It's these old fogies in the House and in the Senate, with the Capitol consumed by anxiety over the coronavirus, rightly so in their case. Judiciary Chairman Jared Nadler, made famous by 2 different impeachments now, lost on both of them actually, rose in a closed-door caucus meeting Tuesday and told his Democratic colleagues they should leave Washington and return home to their districts, unless they're from California, of course, where they would be safer. Unless you're from California or Washington, anyways. Speaker Nancy Pelosi immediately quashed the idea, according to multiple sources in the room. We are the captains of this ship. We are the last to leave, she told her caucus, borrowing a line uttered moments earlier by Representative Mike Sherrill, a Democrat of New Jersey and a Navy veteran. Wow, so she's already plagiarizing. The California Democrat and her leadership team have been feeling pressure from Nadler and others to take steps to avert the coronavirus outbreak in the Capitol, where 2/3 of the senators are older than 60, and the average age of the House members is 57.6 years old. Ladies and gentlemen, the criteria has been met. Those people are in serious danger. The oldest members of both chambers, Senator Dianne Feinstein, Democrat of California, and Representative, ironically, Don Young, seriously ironically, Representative Alaska, both turn 87 in June. Pelosi is 79. Her birthday is March 26th. She'll be 80 on March 26th. Happy birthday. While Nadler is 72 years old, and several, including Representative John Lewis, Democrat of Georgia, are battling cancer. Yes, the old fogies at home absolutely have every reason to be concerned. Because if our government gets wiped out by this, while these people are trashing the economy and scaring everybody who is not going to be affected by it, and then they all get wiped out. If you're writing a book, that's called poetic justice. If you're writing a real life story, that's called a horror tale that we need to not do. The advanced age of many lawmakers is worrisome because older adults, especially those with existing medical conditions, are the most vulnerable. No, they're the only ones vulnerable to COVID-19, the disease caused by the coronavirus. On Monday, the Center for Disease Control and Prevention, for some reason they don't include that part in the abbreviation, don't know why, urged Americans older than 60, it really should be 50, to avoid crowds. Because I know better than they do? No. It's an extra buffer. And the first guy to die in Washington state was 50. So there you go. At least that's the way it was reported, but that report did get screwed up lots of times. First he was a woman, then he was a man, and anyways. Advice that's virtually impossible for members of Congress to follow. At least 27 people have died from the virus in the United States. I believe it's 29. We can verify that. No, it's only 28. Isn't that good news? Let's click on that, make sure. Come on, wakey. And we go back. Now, see, it's only 28. Okay. So, the Pelosi-Nadler exchange came after the House Democrats were briefed behind closed doors Tuesday morning by the Congressional Physician's Office of the Capitol Police and the head of the Administration Committee, Representative Zoe Lofgren, also from California, on the steps for diminishing the coronavirus threat. As part of the effort, the Capitol Physician has been giving lawmakers a crash course in social distancing, a mode of behavior that encourages members to avoid all physical contact, easy, check, including handshakes, and keep a minimum of, 6 feet between themselves and others at all times. I'm going to add the words at all times. Yeah, that's not going to be possible. His preferred greeting, as the physician joked, was Mr. Spock's Vulcan salute from Star Trek. No contact required. It's the 6 feet. It's not going to happen. Yes, so these, ladies and gentlemen, and let's not forget our 3 presidential candidates. Trump is 74, Biden is 77, Bernie, who just had a heart attack. These folks legitimately need to be taking precautions, and they're not, while their states back home are freaking out everybody who's not going to be damaged by it physically, other than maybe some sniffles and stuff like that, if they're under 50. So we've got this great big panic when the people that should be panicked and should be using caution are like, forget about it, we're the captains of the ship. We're not going to give up power. We are not going to give up our power because of a stupid virus. Boom, thud. Yeah, the movie writes itself. Remember that scene in Indiana Jones and the Last Crusade where they were hanging by the earthquake ground split open cliff, and it was either fall and die to try and capture the Holy Grail, or simply climb back out and say adios to the Holy Grail. And remember how many died because they really wanted the power of the Grail? They died for the power of the Grail instead of going, forget about it, I'm out of here. I'll find another cup. Maybe they'll have one at Walmart on sale. This is being done in real life. Pelosi rejects calls to shutter Capitol. We are the captains of the ship, and the captain is in charge. And the captain doesn't want to let go of the Holy Grail, doesn't want to let go of the power. As they squeeze tighter, the power slips through their fingers, and the cooties are after them. Thank you for sticking around for this video and the content in it. We understand that it may not get any views because of the nature of it, but if you are one of the lucky ones who saw it and stuck with it, we appreciate it. If you find this information valuable, please share it. If you want to check out our other videos on this channel, we would greatly appreciate that too. Thank you for watching, and we'll see you in the future. And stay healthy out there. And all of you that are under 20, like you got anything to worry about, except for the freaky people all around you taking your toilet paper. What's up with that?